There are a few other osteotomies we could talk about, but again, we don't want to go into overall complexity on this blog topic right now. So what do we do in conjunction with these? Well, we can do in conjunction, we can do meniscus replacement, we can do meniscal root repair, we can do cartilage procedures. In patients with arthritis, we don't usually do conjunctive surgeries because they don't really need it. To be honest with you, I tell patients this is kind of the scariest part of the surgery is the osteotomy, but if you do it with someone that knows what they're doing, the success rates are incredibly high and the complications are fairly low, especially for the level of surgery that you're getting. What's important to understand is that in conjunction, we can make these surgeries better. So a medial meniscus transplant, if you do the osteotomy, is shown to be just as good as someone with a straight leg. And in some cases, actually, you take the load off more. And as a result, you can actually have improved results. So we're really, really pleased with this. And this goes for both sides of the knee. In terms of the kneecap, when you have dislocating kneecaps, the tubercle osteotomy can help the knee. I've taken care of way too many people where the osteotomy, the tubercle osteotomy was skipped because of maybe difficulty, poor understanding, you name it, and those surgeries can fail as a result. And so generally we're trying to make sure that we don't have our surgeries fail because in a lot of times you have one or two shots to get this right, and the more failures you have, the less success you have. So it's really important to understand this. Another thing is for ACL tears. Recurrent ACL tears can have something called a posterior slope. And there's actually an osteotomy we can do where we cut the front of the knee and we shorten it so that it makes it flatter. This is actually what they do in dogs. So it's pretty interesting. So when you get an ACL surgery in a dog, they actually do this anterior tibial osteotomy. And what we've seen is when we do this, we reduce the re-tears of ACLs.